cardiac rehab program here at St. Agnes has been here about 33 years. We are the only program in Fresno. A lot of patients, after they've had their heart surgery or their heart attacks, are fearful about going back out and doing their regular activities. They don't know what their heart can handle, what their body can handle. And so coming to a medically supervised program like cardiac rehab, where there's nurses and exercise specialists who can help them with that, will then help them build up their confidence and their strength and their stamina and those kinds of things to get them back out doing those things that they love. One of the most rewarding things about being a cardiac rehab nurse is the long-term relationship we develop with our patients. We know that that's probably one of the biggest things, is that connection to us as their nurses and their exercise physiologists, and then the connections with the other patients who've had the same event. And when they do that, sometimes it's lifelong relationships. We have a group of guys that still, it's been probably about 6 or 7 years, they still meet for coffee regularly.
I'm so pleased to have cardiac rehabilitation to offer my patients to help them regain their full activities of daily living and beyond. Often patients will say, "Oh, Dr. Birnbaum, will I be able to do the things that I did before my heart surgery?" And I say, in fact, you'll be able to do more. And I encourage all of them to attend.
I fell in love with cardio rehab probably due to the confidence that they build in you while teaching you, showing you that you can do normal things, you can get back to a normal life and not be afraid. After you've had surgery, you're kind of concerned about stressing yourself in some way. They just take all that away.
From first week of February or so till late June, I was in cardio rehab. They were tremendous. They do a great job of helping you get back.
What I appreciated about cardiac rehab was the personalized care. They took the time to not only talk about my history and what was happening, but then also it was almost as if it was tailor-made for me, what types of exercise I was going to do, what my specific heart rate range would be. So that I appreciated, because I knew that then they were looking at my specific needs. And having gone through it, even though it was just for a month, I think it set the tone for the kind of routine I would set for myself in recovering in the months to follow. It kind of laid this foundation for me as far as how my life had to change in order for me to stay on a healthier lifestyle.
I called them yesterday, as a matter of fact, and told them I was going to come by today and say hi after this. And I told them I missed them. That 3 days a week going in there, once again, you're getting big smiles and people that care, and even though they get you wired up and all that stuff, I mean, they're paying attention to you and they're doing a good job.